Program Director here at Lactation Education Resources.
Hi, and I'm Sekeita Lewis-Johnson, Accredited Provider Program Director here at LER. Thank you and welcome.
Nice to see everyone here today. Just to give you a little bit of background about us, I am an IBCLC. I came from peer support and started my work in supporting families in that way. And I have been board certified for many years. I have recertified a couple of times. I am also worked in a hospital. I've worked in a hospital as well as worked in private practice, and I've been on several boards of directors for different organizations. How about you, Sekeita?
Yeah, thank you, Angela. So my background, I started off as a nurse and maternal child, and I became a lactation consultant about 17 years ago. And I've worked in the hospital, I've worked in a community setting, I've worked in visiting nurses, in any way and capacity. I've also served on a couple boards, national boards that is, regarding the lactation field. And I'm just happy to be here to share my experience and some of the things that I can impart that will help you along on your journey.
Great. So we are going to get started here, and just a little bit of housekeeping. Next slide. So if you take a look at the GoToWebinar interface, you will see here where the blue arrow is pointing to this box, which says questions. That's a way for you to ask us questions as well as to chat with us. Go ahead and give it a try. If you're on your PC today, please go ahead and type in where in the world you are listening to us today. We always love to hear where we are reaching, and it's always a great way to get started. Go ahead to the next slide, and you will see that the green arrow here, if you're participating today on a mobile device, take a look at the green arrow, which is pointing to where you can find that question box. So thanks, Sekeita. So joining us today, we've got a couple of extra folks joining us today. We have Kim from our amazing customer support team. Kim is also an IBCLC and also works in a hospital, and so Kim can answer any questions that you have. And she'll save a few, flag a couple for Sekeita and I, and we'll be able to answer them live so that everyone else can hear the information. Also part of where we are today is Jill. Part of who we are today is Jill. And so Jill is a member of our tech team, and Jill can support you if you're having any sort of challenges with technology today. Jill is here to support you. Okay, great. So do ask any questions that you would like. Go ahead and test it out, and we would love to hear from you. So now let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 35,000 IBCLCs in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners, the International Board of Certified Lactation Consultant Commission, not the examiners, but the commission. Take a look at their website, ibclc-commission.org. They have different regional offices depending on where in the work you reside or where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC exam. What do you need to know? The detailed content outline, also known as the exam blueprint, is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and chronological stages that you would need to know in your work. Our courses cover the entire detailed content outline, and they are approved by LARC. That is the Lactation Education Accreditation and Approval Review Committee. LARC. So our courses are both LARC recognized as well as LARC approved. Our courses are comprehensive, and we're going to get a little bit more into what our courses are a little bit later on in the webinar. But now I'm going to turn it back to Sekeita because she's got a few questions that you need to ask yourself today as you're embarking on this journey to become a lactation consultant. Sekeita?
Thank you, Angela. So before we dive in, and we're going to go over lots of information, and writing these questions down for reflection later may help you to be able to process it all in a way that you can create a plan, right? So the first question you want to ask yourself as we're going over some of these topics is, do I have these skills, right? And keep it at the forefront of your mind. You may not have the skills, and that's okay. So then the next question will become, where will I get these skills, right? And we'll talk a little bit about that as well. So don't fret. However, having these questions and writing them down helps to help you create an individualized plan on where you're going to start and how you can create a plan to finish and become successful. So, we're going to go over a lot of information. Don't be alarmed if you don't get the information initially, because this will be recorded. Sometimes people need to hear it a couple times, and so you can go back and listen to it. All right. So the first thing we talk about is competency, and I'm going to say competency is crucial, it is critical. And I like to use the analogy, for example, of if you had to have heart surgery, would you want your primary care physician doing your heart surgery who just read the book about it, or do you want a heart surgeon that have had the clinical skills and the experience and all the requirements to do your heart surgery? I'm going to guess that you want that heart surgeon, right? And not your primary care physician, right? Because your primary care physician is not competent in doing heart surgery, right? That is essentially what competency is. But let me talk about what the definition is. It means that you have the ability, the knowledge, the skills, and the attitude to do a task and to do it successfully. So, in a nutshell, a lot of times when we start in any profession, we always start off as a novice, someone brand new to the field, right? And then we move, if we continue along a continuum of professional development, we move along and we are practicing those skills. We didn't just kind of become an IBCLC just to have letters, right? We practice those skills and then we move along to becoming an expert, right? So for the most part, when we all start out, it's like, okay, I'm not there yet, I'm a novice, but what we hope that by the end of your training, that you are competent in the foundational knowledge and skill set that you need initially, okay? So there is a rationale for the different pathways, but you also want to keep in mind the pathways to also getting the clinical hours that you need, and Angela will break it down. By the end of your training, you want to be confident that you are competent. Therefore, hopefully you'll do no harm. And that is essentially why competency is so important. Culturally appropriate and credible. Let's really talk about what culturally appropriate means. If you worked in healthcare, you probably would have heard the word culturally competent. Some people have heard the word cultural humility. However, culturally competent is a word that we talk about a lot. And sometimes, if we use the sense in the word of competency, can you ever really master someone else's culture? That can be arguable. But anyways, for the sake of this conversation, we want to be really clear. And we know that language is important. So how we discuss these types of, how we discuss anything culturally actually should be really held to a standard of making sure that we are using the appropriate words for what's fitting for where we want to be. And being culturally appropriate means we start with cultural humility. And it means that cultural humility is defined as a lifelong process of self-reflection and self-critique, whereby we not only learn about our own culture, another person's culture, but our own culture. And it starts with an examination of our own beliefs and our cultural identities. And that's the definition that can be found on the National Institute of Health. And that's just one definition because there's many. So, but in a nutshell, all of the definitions state that it is a lifelong process. So when people say things like it's not in their culture to do X, Y, and Z, that probably is not a culturally appropriate statement. We want to avoid saying things like that, really, because within cultures, we know that there are subcultures. So the first part of culture of humility is not feeding into stereotypes and not making assumptions about what someone will or won't do based on their cultural identity, right? Because you really don't know unless they've told you something particular about themselves that matches with your assumption. So culturally appropriate care is that individualized care, but it also again starts with us examining ourselves. Credibility is like, really, are you a credible resource, right? When you're asked a question that you don't know, how do you respond? Sometimes human nature tells us to just respond because we want to give an answer so we don't look maybe like, incompetent, right? We want to give an answer. And whether it's right, wrong, whether it's based on our experience. And I'm going to say, when you're asked a question, if you try to answer it off of your lived experience or off of a whim of kind of like what you think the answer may be, you will probably lose credibility, okay? Losing credibility as it relates to the lactation field and the lactation profession is a good way for other lactation consultants to lose credibility. So, you want to make sure that you're not given information based on how your breastfeeding or chest feeding experience was, right? You want to give information that that coincides with the best evidence, and B, you really know what you're talking about, okay? So do you know what the evidence says? And if not, do you know where to find it? We have information now at the tip of our fingers, understanding we're not all walking dictionaries or walking computers. And so it's impossible to know everything by the end of your training. So credibility is really about saying to yourself and saying, okay, I know enough to say I really don't know that, but let me get back to you because I got a resource that I can dig into. And credibility, like I said, it means everything because that's how people learn to trust us as a profession. And if they can't trust us to help them meet their goals, they won't utilize our services. And then that's a bad reputation for the profession itself. We also are policy advisors and creators. We are also advocates, and these two kind of fit in the same bucket. So we advise on policy. We actually help create policies. And that's important to know from a standpoint of talking about the clinical care or any policies that impact outcomes or clinical care. Remember I said, do you have the skills, right? So some of you in this space might already have taken a course or two on policy or may already even be in the policy realm. And you're like, okay, I got this. I know this stuff, right? Good, we need you. But we also need people who maybe don't have policy as a strong suit to sit in the rooms where policies are being discussed because your voice matters. You are a stakeholder. So if that's not your strong suit, you already understand that your role is to still show up and advocate for just policies inclusive to just language. And so policy are truly created by humans, and it impacts us sometimes with the language put in there. And then that kind of really informs where your advocacy is going to go. This is a big, big part of what we do and who we are. A person that's an advocate is just simply a person who publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, you can be the person at the table listening to how policies are created and lending your voice based on your perspective and your lived experience on why this might be a great policy or why this might not be such a great policy. Problem solver and researcher. Problem solving is about 90% of what we do because every single family has their own set of concerns, right? When we're called for support, we're usually called to help someone solve a problem or an issue that they may be having with breast or chest feeding. And so it's important to not walk into these situations and think that, for example, with latch and positioning, that there's a one size fit all I need to do is tweak the position, right? All I need to do. So never, in this instance, know that one size never fits all. And we really need to be problem solving and thinking about our families from this individualized lens of what the particular family is saying to you and what the concerns they're sharing. You know, remember I said sometimes you have to go back and say, hey, I don't know this, let me go look it up, right? There's where we become a researcher, right? There's two ways to be a researcher. There's people who carry out academic research, but there's also people who go and verify and look at what the literature says about a certain topic, right? So yeah, we need researchers, academic researchers that is, that carry out that work, but we also need to understand that our role in understanding where do we get our information, what governing body do we seek for the clinical protocols for lactation, and there are some out there. So you want to be sure that your job in this instance is that you're the person who starts to discover or verify information, and that's all of us. You know, when we, like I said, don't utilize the tools that's available to us in the point of time of care, that's when things can go awry and families can really like miss their mark and miss their goal or what they're trying to achieve with their feeding goals. So, you know, going into this and giving an answer off your whim and not diving into the research can be extremely problematic when you're trying to help families. High-level skilled lactation care. I just kind of made one word with that. But anyway, high-level lactation care that is skilled. High-level lactation care, they go, and skilled care go hand in hand. We talk about high-level lactation care. I'm going to give an example. When I talk about high-level lactation care, I am talking about the level of acuity. And there is an acuity model based off of Rebecca Mano's work. It's a model that basically takes into account the risk factors for the maternal issues and the baby's issues and what can kind of cause premature weaning. And then by that, once you consider both, they fall within 3 categories: level 1, level 2, and level 3. Level 1's is a category that bedside nurses or people with the most foundational knowledge can assist with. The level 2s and level 3s are the levels that IBCLC should be called in on. So when I talk about that, that's what I'm talking about. So I'm going to give you an example of basic breastfeeding care that can seem basic, but also can turn into a level 2, which is assisting with latching positioning. In this instance, we're going to say, hey, there is nothing anatomically wrong with either the infant or the parent. They have no issues. There was just a little bit of reassurance needed that the latch was going okay. That's level 1 versus someone who's in the ICU who was lactating prior to entering the ICU and who is on life support. That is a level 3. Are you going to be able to deliver the type of care of a level 3? Are you going to be able to look at their medications and say, whoa, okay, let me look at all the medications and look at the safety profiles? Are you going to be able to manage or try to assist the nurses in managing a person that's intubated, or this person may have a brain injury, right? How does that brain injury impact lactation? Are you going to be able to make those connections between the two? So when you're doing your training, sometimes it's so much and you're like, oh, I don't really need to know about the brain. And I'm going to tell you, you do need to know about the brain, right? Because that is the level of care that sets the IBCLC apart, that can make sound clinical decisions, right? That is appropriate for that level of care. So when we talk about acuity, again, we're talking about the level of acuity. So when we talk about skills, your skills should match that level of acuity. And I'm going to tell you right off the bat, I just gave you somebody that's intubated with a brain injury, the worst of the worst. I will say that is somebody that I have truly managed. That's why, I can speak about it. But that's not your everyday clinical situation, right? But the expectation is that you're going to work yourself up and get the experience, or even get the knowledge of how to manage complex cases. So when we talk about levels, that's what we're talking about. Build your skills, build your skills, build your skills. So if there's something that is not your strong suit, that's what you want to focus on when you're trying to determine what's the pathway that's correct for you, as Angela's going to go over in just a few minutes. The other thing we found out is that essential became a buzzword during the pandemic, and that we know that lactation consultants are essential. Yes, we are. We found that out. And that we are really responsible for timely care. There's a window of opportunity to help a family reach their goals. And if we miss that critical window of opportunity, there goes that person's feeding, there goes that baby's health, potentially a lifetime of health, if you know anything about what human milk does for the lifespan of our bodies, right? So we found out that essential is a buzzword. We also found out that babies were still being born and they needed to eat. And at that time, that babies and families were being discharged sooner than they had been discharged prior to, and that was also fast, right? And it became, for a lot of lactation consultants working in the field, it really became critical that we helped to protect and promote the ability to provide human milk, because we were in some emergent times of unknown. So when we think about essential and we think about how crucial that was, yes, breastfeeding and chest feeding, there's bonding, there's all of those things that sometimes we kind of romanticize and we're like, oh, baby, just cross to the breast. All those things are good, right? But from a public health and prevention standpoint, human milk at that time was so essential for babies because it provided protection. And then we were like trying to keep up with what was going on to be able to help families to be able to provide that human milk to their baby during this uncertain time. So we are essential, and it's important that we show up when families need us, that we are timely, and that we couldn't, it wouldn't have been prudent to say we're in a pandemic now. I don't know when it's going to be over, so I can talk to you over the phone, but in essence, you're on your own. Understand we are frontline workers. And so I just want to make that really clear. We talk about telehealth. Telehealth is good. It really is. It bridged the gap in a lot of cases. However, in some cases, it did not, because in some cases, you have to be able to use other senses and other ways of knowing. And the only way you can do that is in their presence, right? Telehealth can prohibit us to use those other senses. And so I just want to be really clear about that, is that we have to be timely and we have to advocate in those times that we do become essential for babies and families that otherwise may not even know how to work systems, may not know how to advocate for themselves. And so it's our duty to show up so that we minimize harm caused to these families, that we are accessible, because that's what becoming an IBCLC is about. It is about being able to provide accessible care at the time that it's needed. Being a trusted collaborative care partner. Collaborative care partner is one of the phrases that I love so much, and that's how I approach care, because what it assumes is that it assumes that you are collaborating with your patient or your client. It assumes that you're not the center, you are not the decision maker, you are the collaborator. Remember that in lactation, it's the family and their partner and their goals and their fears, it's their barriers that takes precedence over your goals for them. So, you know, what am I saying? I'm saying we all know that the recommendations is exclusive human milk and breastfeeding for the first 6 months, at least, right? We know those things, right? And we advocate for those things, and we're like, yes, we want everybody to do that. Right. It's important we still honor those within ourselves, and we still talk about them, right? We still educate about them. Excuse me. However, we have to understand that we are collaborating in partnership and in agreement that when somebody seeks our care, if they say, hey, my goal is 3 months, then we give them all we got to help them do their 3 months. Even we can talk through what the recommendations are and all of those things, but that we understand we're not the decision makers. We're not, we should not go into situations approaching care and overstepping boundaries that are not meant for us to overstep. Can you use a spirit of inquiry to figure out if there's some barriers that they may be having about regarding that 3 months? You could do that. You could approach care in that way. But again, we still have to honor the things that they're saying. And that's how you become trusted. In all honesty, you become trusted to do no harm, to be reliable, trusted to be like, to say, you know what, I see you as a person and we're in this together. I'm not higher than you. We are collaborating to do what is best for you. That's how you become trusted. When you walk into certain clinical relationships and you assume a hierarchy, and sometimes this happens, I can't talk enough about this, how this happens. You assume you're the expert, you know all about this. You've been teaching this for 15 to 20 years. You've been supporting families even before the 20 years when you became certified, right? And you walk in like, yeah, I'm gonna tell you how this is gonna work. This is what's gonna happen. This is how you're gonna do this. Or when you walk in and you touch someone without asking permission, right? They said they wanted assistance with latch. Let them tell you what type of assistance they're looking for before you just go in and touch and all of those things. Understand you are collaborating. You are there as a collaborative person, and that's how you become trusted. So patient-centered care is what I've talked about, or person-centered care is what I've talked about. If you work in healthcare or anything around healthcare, you may have heard this word, but the person is in the center of all the things I've discussed. I've discussed culture, I've discussed the types of care and the acuity, I've discussed collaborating, being the collaborative partner, and communication. The definition of patient-centered care is providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So I've talked about all of these things, and again, don't let it become a buzzword like the other word has become. Really try to practice what this model looks like, and then, that's how you build trust. When I was precepting in the hospital setting, we would have, the way we triaged our clients, we would have access to their charts, right? And I would literally, before we walked in the room with the person I was precepting, we would go over everything they knew about this person. And then I would say, what don't you know? What don't you know, right? Because from that point on, I want that person to forget all the chart stuff. I wanted them to forget, to unknow all the stuff that they just learned, and to really go in here and learn the person. Again, learn their barriers, learn their personal goals, learn those things, because those things are important. All the objective data that we were able to get from the chart, becomes a little less important when you focus on the person, and that helps you to develop a real individualized plan and goals that that person probably can meet. So I just want to leave you with that. I also want to leave you with some additional questions to ask yourself today. Hopefully you wrote those other questions down. These are also going to be some reflective questions that you can use. Angela's going to start to talk about the pathways. What pathway is appropriate for you, right? What is the local market in your area? Meaning, have you done a market analysis? Do you know where IBCLCs are working in your area? How does all the studying or the clinical hours fit into your lifestyle? What does mentorship look like if you're looking for a mentor, right? And do you have the requirements? You know, what is your current job commitment with family, school, or your faith, right? Thinking about all of those things will help you develop the plan and the pathway that's most appropriate for you. So I am going to turn this over to Angela, and Angela will take you on this journey.
Thanks so much, Sekeita. Those are all phenomenal questions. Thanks very much. Okay, so becoming an IBCLC, here are the different steps that you're going to need. This is your roadmap. And it can feel a little bit complicated. I see a lot of the questions in the chat. People are asking a lot of questions, and we'll answer those, a few of those live, even though Kim already got to them. And we're going to touch base on all of these different pieces. So the first thing that you need to do is choose a pathway. So you see that pink circle there? That's what you need to do first, is choose a pathway. And we're going to come back to that in just a minute. The next slide shows that you need education. Then you need clinical hours. And then on the last slide with that green circle highlighted, this is where you need your exam prep. Okay, so first thing that you need is education. So it is the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find the full list on the IBCLC Commission's website. Now, the 8 courses that you need under education is, and you don't need to write these down, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. Now, to the person who asked the question that they took these courses earlier in their college degree and they're wondering if they count, the answer is yes. Even if it was 20 years ago, they count. For those of you who still need the college courses, we partner with Walden University to provide these basic courses. Walden is online, and they've chosen the courses that best fit the Commission's requirements. We're collaborating with them to provide our students with deep discounts for the college courses. You can find the link to Walden on our website. Start with the banner listing that says training options, then click on I want to be an IBCLC, then go to education, and you'll find the link there. Now, there are also 6 general education subjects, which do not need to be taken at the accredited university. The topics are medical documentation, medical terminology, occupational safety and security for health professionals, ethics for health professionals, one second, there it is, and universal safety precautions, infection control, and basic life support. So 5 of those general education courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there may be an in-person skills check for this training. But I have heard of some organizations, even as recently as just a few weeks ago, that are providing this training completely online. So it's important to check with your resources. So the guide from IBCLC from the Commission provides general description for typical courses in each one of these subject areas. Please keep in mind that the IBCLC is international. The names used in that document to describe the course may not exactly fit the description of the course at your accredited institution. That's okay. you're going to notice these broad terms with the understanding that there is no one universal definition for what a course in, say, clinical research is going to cover. So why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional, and those courses are going to help you to be prepared for your career as well as to pass that IBCLC exam. Okay, the second piece of the education that you need is lactation-specific education, and this is where we've got you covered. The education should be comprehensive and cover the detailed content outline. The Commission requires at least 90 hours of lactation education, 5 hours of communication skills, and our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. Our 2-hour course on the International Code of Marketing of Breast Milk Substitutes, also known as the WHO code, is updated and relevant to your work as an IBCLC. So the third component you need is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. So how many hours do you need? Well, that depends on your pathway. And so here on this slide, you can see that there are 3 pathways to become an IBCLC. So pathway 1 is for healthcare professionals and those who are part of a recognized IBCLC breastfeeding support organization. Healthcare professionals include, according to IBCLC, physicians, nurses, midwives, dietitians, physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, the Australian Breastfeeding Association, amongst a few others. Now, pathway 2, they must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. It's a self-contained program. Now, that education has both the didactic and the clinical components, and they require 300 clinically supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. So the IBCLC, or if there's more than one, all of them must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. So just a quick note for those of you who may have breastfed or chest fed or provided human milk for your baby, the hours that you spent nursing, pumping, helping all of your friends, sadly, they don't count towards the clinical hours that you need. Now, while 500 or 1,000 hours may seem like a lot, there's a really good reason why. Each candidate needs to have the clinical experience they need so they can provide competent care as an IBCLC. So, again, with clinical hours, candidates who are applying through pathway 1, as I mentioned before, they need 1,000 hours. So for the person who's also a healthcare provider, the hours can be done in a hospital, birth center, lactation clinic, or a practice, the lactation practice, or an independent private practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. Now, it's important to note that these hours do need to be counted on an hour-by-hour basis. So 2 important notes about the clinical hours. The first is you need to document them as you accrue them. Be very detailed in case IBCLC chooses to audit your application for the exam. They may want to see your documentation, such as a spreadsheet or some other document where you counted your hours. And the second thing to note about the clinical hours for pathway 1 is that they do not need to be directly supervised. So note that we do have a program For those of you who are not already affiliated with a breastfeeding support organization, the LER Hours program for our certified breastfeeding specialists offer you a way to gather those 1,000 hours in your community. So now we're going to move on to Pathway 3, and as I mentioned, that requires 500 hours of clinical experience. And that's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, and those providing human milk to their babies every day, such as in a hospital or a clinic setting. The hours count towards your 500 only when you're actually working with families. The observation hours that you spend do not count towards those clinical hours. Now remember that clinical experience is graduated, meaning that it starts with observation, then you'll do a few things under supervision, and then you're going to start to complete tasks independently with the IBCLC nearby in order to ask questions and discuss the situation. So LER does have an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns are going to spend about 75 hours in orientation before you can begin to accrue the 500 hours. Or take a look in your community to find a willing internship site or mentors. Now, you may need to approach many people to find someone with the time, the experience, and the capacity to agree to be your mentor. So don't get discouraged. It's really important to find that good fit. Now, while this pathway does have an extra step or two, some people will ask, is it worth it? And the answer is yes. IBCLC reports that students who come through Pathway 3 seem to score quite well on the exam. I believe it's that mentorship, which is that key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic, which indeed we're still at the tail end of the pandemic. Now, the quick answer is yes. The longer answer is paraphrased from IBCLC documents. They will allow the use of technology as long as certain parameters are met. You're going to need to pay attention to privacy rules and the Code of Professional Conduct and clinical competencies for IBCLCs. Now, at LER, with the education piece for lactation-specific education, we have two ways for you to gather those hours. The first one is our Lactation Consultant Training Program. LCTP is 95 hours front to back. The other is either the core or the bridge course. They're designed to meet your education needs depending on your background and your previous lactation training. So first, we have a comprehensive course called LCTP, which is 90 hours. It's eligible for CME and nursing contact hours, and it is LARC approved. It's intended for those who don't have any lactation education and they know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced, amazing instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. The classes that you'll find are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We've updated our course information with the latest peer-reviewed evidence on a regular schedule, but we will update sooner as new evidence emerges. Have questions for the instructor? You can send an email to our support forum, and we have IBCLCs like Kim on today's call available to answer your questions. So upon completion of the 95-hour course, you're eligible to take our Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam, again, through our hours program. Now, if you're not sure where to start, or you already have some lactation education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as our LCTP course. Now, our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52 plus hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a certified breastfeeding specialist exam. Now, that bridge course, that is really ideal for people who have the basic lactation education and they need an extra 45 hours to qualify for the IBCLC exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. So now, if you're not sure where to start, well, if you're new to the profession, I would suggest our core course. Sort of take it and see if it feels right, if it fits right, and if you like the content which is presented. Now, I do know that these requirements can seem like a lot, but we are here for you every step of the way. If you have questions about the pathways that don't get answered here today, please be sure to reach out to our friendly customer support department. As I mentioned, many of our team are IBCLCs, and they know the process inside and out. We have 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about which would be right for you, again, our customer support team is here to help. Now, if you're not a healthcare professional working directly with families, getting those hours can feel like a challenge. We have 2 programs to help you with those clinical hours. One for Pathway 1 and one is for Pathway 3 students. And finally, when you're ready to take the exam, we have you covered there. We offer 2 versions of our very popular exam prep course. We use the LER QBank system, which is a comprehensive system including practice exams, photo flashcards, anatomy flashcards, a study schedule, and a lot more. For those who take our 95-hour course, we have a discount too, our exam review course. Now, our 90-hour course, as well as Core and Bridge, are available in Spanish online. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. Now, at LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of our commitment to increased access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize that one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. We will remove that barrier for Rising Tide and Juntos Triunfamos scholarship awardees. We alternate these scholarships each year. You can find out more information on our website, lactationtraining.com/Rising Tide. So to wrap it up here, you can get your content questions by experts in the field. Last week, someone reached out to one of our instructors with a question from their own practice. We made the connection and the former student received the answer to help their client. Another student had a question about creating a policy at their facility, and we found the appropriate instructor to answer the questions and to provide additional resources. So we are here to support you in every step of your journey. So, Sekeita, this has been wonderful. Thank you all very much for attending today. And now let's take a look at what questions we've got. I see one that's a little older meaning earlier in this presentation. Someone has been working at the WIC program for 11 years, providing support and has a majority of the healthcare sciences done. Yay! and they're wondering about pathway 1.
Right. So, excuse me, providing breastfeeding support. I just wanted to make sure. Pathway 1 would be a pathway that would be appropriate for you. Absolutely. Yep.
Because you've already got those clinical hours. So that's a huge, that's phenomenal that you've got that. So yeah, getting those extra college courses, it sounds like that would be what you need, as well as the lactation education.
Yeah. There's another question, Angela. I'm a breastfeeding counselor and doula, and I want to become an IBCLC. Which pathway should I choose? I have some of the course requirements that I already took from being a teacher.
Excellent.
So in this instance, you know, to be honest with you, the question asked was which would be, what do you think would be most appropriate? Understanding you have a lot of the course requirements already, probably pathway 1 or pathway 3. You know, if you're saying you're already a breastfeeding counselor, it seems like you're in a doula, you're already racking up some hours that you would be able to accrue. And so those are the two that you might want to think about, and think about the benefits or the perks of doing either one. I'll give you an example. As a registered nurse that was already working at the bedside, a lot of people assumed I did pathway 1, but I actually did pathway 3. I wanted a mentorship. I wanted the actual clinical hours that were dedicated and focused on, because we also had an outpatient clinic. So I was able to see a little bit more, and I understand I had the privilege of working at the hospital. Trust me, I understand that my clinical hours, but I also wanted that mentorship. And so I was able to follow a couple of IBCLCs to get those clinical hours. And so thinking about where you are in your journey and what you hope to achieve also will help you determine the best pathway for you, and also how feasible is pathway 3 versus pathway 1. That's the other thing I ask people to think about, because just because pathway, you might want pathway 3, it might be challenging to find a mentor, right? And so you might want to think about those types of things as well.
Great, thanks so much, Sekeita.
Angela?
No, I think that's good. I see a question that Kim answered, but I think it's relevant, which is, how long is this training to become an IBCLC?
Yeah. Well, it can take anywhere between 3 to 5 years, I think, if you do it and get your clinical hours. It depends on your pathway. If you are, for example, if you're a pathway 2 student, they have the curriculum set all out. They have, you know, most of them, I think, are 2-year programs or something like that, maybe 2.5.
It's, yeah, I think it's part of a comprehensive, so like you would want to be getting your college degree.
Correct.
And it would be that specialty. So yeah, it might be 4 years even.
Correct. But, you know, getting those clinical hours, it depends on how much you've already been supporting. So for example, someone who, let's say, let me differentiate. So someone who, for example, in the hospital setting, they work labor and delivery. Most of their time is supporting labor. I'm going to be honest. I work labor and delivery, so you really can count the hours for real, right? But someone who works mother-baby in the postpartum unit, their hours might be a little different because they are supporting lactation a little bit more than the labor and delivery nurse. So it really depends on how you're accruing your hours, where you're accruing your hours, and how much time do you have to dedicate to get those hours if it's not in your everyday scope of job, right? And so there is a calculator that people can find out how much of their time can be used if they already work in healthcare. If you are, for example, if you're a breastfeeding peer counselor that's working at WIC, right? Mm-hmm. And your job is really peer counseling, you're getting a lot of hours supporting families, right? So it is going to be based on the individual characteristics of where you work at already and how you see lactating people and supporting their journey. And I think that can range, like I said, for pathway 1 is 1,000 hours. So I think that can range anywhere between 3 to 5 years.
Right. And it depends on how much time you can spend, right? It's like if you can spend half of your time working with families, then that 1,000 hours and you work full time, I mean, you're done in a year. So,
Yeah.
and to your point about, different settings, there's someone who asked a question about they've been a NICU nurse for 13 years. And so remember that as someone who's done that sort of specialty, and I'm saying this to all healthcare professionals, but especially those that have worked in a specific unit, you need to support the normal course of breastfeeding from preconception all the way through weaning, which could be several years. And so you may have that, the NICU content and sick babies on lock. And so supporting that normal course is also something that you'll need to be mindful of.
The other part is I too have worked in a NICU as well. That was
Yes.
and I do know that, for example, we're focused on the acuity of the baby. A lot of times we don't get a lot of hands-on clinical supporting of the dyad when it comes to nursing. And so that's a whole nother topic in itself. When I talked about making sure you have the clinical hours, because that does determine competency, we really want to be clear that please get the hours. Please make sure that the hours that you're reporting have been dedicated to people. And this presentation, when I talk about harm, because this is the realities, right? We're talking about realities. I have seen some harm that has been done because people assume that they had the hours and they had the knowledge and they assumed that they had another license. And it's like, doesn't work like that. You really have to have the clinical skills. You really have to be able to put it all together. And you really have to rely on having the experiences that you need to deem the competency of the most fundamental, but also how to critically think through complicated cases. And so just saying that, giving you the realities mean kind of like going back to the drawing board, like I suggested, and kind of thinking about, yeah, where am I going to get my hours so that I feel competent, like I am competent, not just to sit the exam, because people are great exam takers, right? But I'm talking about translating that knowledge into practice. Will you be able to do that and do that in a way that causes no harm?
Perfect. So a couple of people are asking questions about the clinical practice calculator from IBCLC, and someone would like for someone to take a look at it in order to see if they're ready to sit the exam. You can reach out to IBCLC. They are not typically able to answer specific cases and specific questions. And there's someone who's saying, is there someone who could review my employment verification letter to see if it's appropriate to submit? So you see, here's the thing, is that you don't need an employment verification letter. All you need is for you to self-document the percentage of time that you spent working with lactating people in the 5 years immediately preceding your application for the exam. And so there is a little bit of trust there. The only time that it would be problematic is or it's not even problematic, it's just the only time you'll have to do more is if your application to take the exam is audited by IBCLC. Then you're going to need to show your practice calculator and how you calculated your hours, and you may need a letter from your supervisor that says, yes, I can attest that Sekeita worked at these hours and worked full time, and that Sekeita spends 20% of their time working with breastfeeding families. That's it. So it's super simple. So try not to get too concerned about that piece of it. I know a lot of people do, and I understand the why. And a lot of people will ask the same question about college courses, like, oh, how do I know if my course counts? If it's pretty closely, or if it even generally talks similar language as to what the IBCLC conditions description describes, I know I just was redundant there, but if it's pretty close, then chances are it's going to count.
Angela, here's another question. What about private clients? Can they be submitted?
Sure. And you don't need to keep protected patient information. You don't need to keep confidential information. You need to, though, document, like today is the 14th of October. And so let's say that you saw someone, 2 people today. Or let's say you did you taught a prenatal breastfeeding class. Well, the number of hours that you spent working directly with those families would count. If you are with either a healthcare provider or an accredited breastfeeding support organization, or you have a mentor. So those are the things, is that you want to make sure that you're earning and accruing the hours according to your appropriate pathway.
Yeah. I want to discuss this one. It says, I am an RN working nights med-surg for 2 years. I am trying to transfer to mother baby, but have not been successful. Sounds like there are other options if I cannot get hired in mother baby. Also, I thought I should take Pathway 1. I recently purchased the LCTP program. Thank you. So yeah, there are other options. And Angela spoke to it. If you've already purchased our 95-hour course, for example, you would qualify to do the hours program that we have to be, if you were like becoming a CBS, because you become a CBS through that course, you could start to accrue your hours by your own private practice, by you seeing and supporting families in your community. Of course, it is structured. It is a program. Angela, if you want to speak a little bit more about it, but Pathway 1 would still be appropriate for you because you already have the science, already have the background. You know, if mentorship was not an option, Pathway 1 is definitely an option. Angela?
And being able to find those families, that's the piece that you would need to do. So I think that's something which I think that makes a lot of sense. Someone else mentioned that they live in a retirement town with limited access to getting clinical hours. Any advice? So it depends on what sort of certification you have. You know, there are some breastfeeding support organizations who will allow you to gather those hours as clinical hours via telehealth through Pathway 1. And so you'll want to make sure, if you're a healthcare provider, then you'll want to make sure that you're following appropriate privacy rules. And or if you're part of a breastfeeding support organization like LER, then you'll just need to follow those guidelines in the scope of practice and things like that. So that's it. There was another really good question here. Oh, someone says, I support moms like more than 12 years, but normally by phone. Does that count? So it depends on how you are, under what organization are you providing that support. So if it's something like La Leche League, I know the answer is yes. And if it's, or the Australian Breastfeeding Association, I know the answer is yes.
I don't know if we answered this, but someone says, what about hours with private clients? Can they be submitted? Absolutely. If you're working under Pathway 1, absolutely.
Yeah, do you want to get, do you see that last one about, I'm also happy to email someone. I'm thinking I finished the 95 hours, become a breastfeeding counselor through that. Then I could do the LER, and I'm also a therapist in early intervention. So yeah, I would say become a breastfeeding counselor through us. And then that way you can count your hours. If you're also a therapist in early intervention, then the time that you spend working with breastfeeding families would work perfectly.
Is WIC an organization that's recognized? Yes.
Pathway 1, yep. So I want to go back to, so there's quite a few people from different parts of the world. And I want to go back to the person who asked the question from Lithuania.
Okay.
And because I have a special place in my heart, my husband's Lithuanian. So to the person who has that question from Lithuania, as I'm going all the way back, we also have somebody from Greece here. So here we go. They purchased our lactation consultant training program. Great. When should you start planning to take the exam? Well, it depends on how quickly you can get through our content. And then once you get through the content, then you have to get the clinical hours. So those questions Sekeita asked, how are you going to get the clinical hours and how quickly can you do that? The exam is only offered twice a year, and it's offered in only English in the first half of the year, and it's offered in several translated languages in the second half of the year. Typically, it's been the first part of the year is like March, April, and the second half of the year is usually in September. There is an additional fee as well as additional requirements if you don't pass the IBCLC exam the first time. There are ways for you to take practice exams, but none of them are through IBCLC. So there's no official pathway. Remember, lactation consulting is a relatively newer discipline. It's only been around for 40 years this year. So that's the piece. And then questions about registration for the exam in Lithuania and where the exam is usually held. I would say you can contact the European office of IBCLC and they can answer those questions. Okay, good, Sekeita. Is there anything else here?
I'm not seeing anything else. I think we answered everything. There was a thank you for all the information that just came in at 3:06, and I believe that's it.
Yay, this is great. Good. Well, thanks, everybody. Those are great questions. Thank you so much. This is phenomenal.
Yes, thank you for joining us. And I hope that, you create the best plan that you can make for yourselves and that your journeys to this pathway, whatever pathway it will be great and will be smooth, and you will hopefully achieve your goal.
Agreed. Thank you all so much for joining us today. Someone just asked a question. Is there a time limit for acceptance of credits? You need to be done with everything before you apply for the exam. So just want to say that. You want to have your college done, you want to have your clinical hours done, and you need to have your lactation specific training done before you apply for the exam. Super important.
Absolutely.
Okay, great. Have a great rest of your day, everybody.
Enjoy. Bye-bye.